Dr. Washington, in your written testimony, you stated that, and I'm quoting, "The hospital preparedness program has been cut by more than 50% over the last 20 years and remains stretched due to prolonged emergency responses, increased preparedness and response requirements, and annual discretionary funding not keeping pace with inflation," end quote. As the only source of federal funding for healthcare system readiness, I'm concerned that the stagnant funding will decrease the ability of local hospitals to serve all the patients who need care during emergency or disaster. What are the practical implications and or limitations of stagnant funding for the hospital preparedness program, and is there more Congress can do to help?
So I think there are tons of implications specifically for being ready to go. As we saw during COVID, our acute care facilities were literally crushed with demand. Our emergency departments had waits that were extending well beyond 10 to 12 hours, and the ability to be able to care for people in a timely fashion was almost impossible. One of the things that our preparedness coalition did, that's funded by HPP in Mecklenburg and our region, was to mobilize our mobile hospital. We can't just purchase a mobile hospital in real time for an emergency. We have to have those things ready to go. They have to be well maintained, and they have to be ready to activate as quickly as we need to be able to respond and provide care to folks. And so increasing investments in the preparedness of our healthcare systems is really, really important, and we haven't kept up, and so we need to catch up in order to be able to make sure we stay prepared.
Great. Thank you. With that, Mr. Chairman, I yield back.